Pregnant women, the aged and disabled in Kweikrom, a community in the Gumua East District of the Central Region, are the most affected as they are having to travel several kilometers to Winneba to access healthcare. The residents there are threatening to resist attempts by politicians if a CHPS compound abandoned for the past 4 months is not fixed immediately to cater for their health. From Kweikrom, Henry Kwesibedu's report read to you.
Dorothy Adu and Mary Otto both went into labor one midnight. A taxi in the nearby village was their savior, as there was no vehicle around to send them to hospital. They traveled on a terribly bumpy road over several kilometers to Winneba. The nearest health facility is about 2 hours' drive from Kweikrom.
It was a painful experience traveling on the terrible road to the hospital.
My water broke around 1 a.m. My family had to call a taxi driver from the next town to transport us to Winneba. The cost of transportation was about 50 Ghana cedis.
They speak for several other women in this community where there is no health facility. Community health-based planning services, popularly known as CHPS compounds, were introduced as interventions for areas like these. For Kweikrom, however, one of such facilities is only half-baked and rotting away. The abandoned structure has been roofed with doors fixed, but without windows. Dorothy and Mary say even though they have their children now, the pain and anxiety could have reduced had this CHPS compound been completed when they went into labor.
The CHPS compound is just about 10 minutes away from my house. The pain I endured could have been less if the facility was operating. We need government's intervention.
They paid to be transported to Winneba, but for many other women in this community, affording transportation fares is a problem. So they deliver at home with all the risks associated. The problems are not limited to pregnant women. 46-year-old Kujata has a mobility disability.
The facility has been abandoned for the past 4 years. Persons with disability like me struggle to access clinics and hospitals across the country because most of these facilities are not disability friendly. Traveling to Winneba to access healthcare is quite challenging for me.
Every election year, come to Kweikrom appealing for votes. This time, the community is leveraging its numbers to demand the completion of this CHPS compound. They will not allow political campaigns here in 2020. Daniel Kofiajiman is Town Development Committee Secretary of Kweikrom.
If you don't see this project completed before 2020, they shouldn't even bother to step a foot here to come and campaign. We will change them with machetes and cutlasses. I'm speaking on behalf of my youth members. If you don't see the completion of this particular project here, no political parties should even dare coming here to come and campaign. It won't happen. And I'm saying this on behalf of the chiefs and the youth, that we are not going to sit down for them to come and deceive us again.
Today, hundreds of them are receiving free health screening organized by the Physical and Mental Health Foundation in collaboration with the Rotary Club. They appealed to other philanthropic individuals and organizations to come to the aid of the community.
Today is a maiden edition of our collaboration as a club, the Rotary Club of Accra and Suman, collaborating with Fiscal Health Foundation. We are dispensing medical services to the people of Kweikrom in the Gumua East region of the Republic of Ghana. And I being the charter president and the current president of the club, we took a casual visit to the town, had an interaction with the leadership of the town and realized that they have peculiar needs. And some of these needs fell within our operations. And then we felt like, look, let's really give them a hand. Let's extend our services to them and then see how we could bring them some sort of medical relief.
A glance at the structures shows it should not take much for government to fix this CHPS compound with the urgency it deserves. Henry Kwesi-Bedu's report for JoyNews.
And we are still seeking answers as to why that CHPS compound have been abandoned for the past 4 years, when indeed pregnant women and other residents are suffering as a result. And you saw in that report also that the Physical and Mental Health Foundation gave some kind of help to the residents as well. And Jeremiah Nkrumah is the co-founder. He's a mental health officer and a co-founder. And thankfully, I have him join us here in the studio for a brief discussion on this issue. So I'm sure that prior to wanting to offer your services to these residents, you've tried to also find out as to why this CHPS compound has been abandoned. Did you get any answers?
Not really. So far, what they told us was that the politicians always moving year by year or year after year to promise them of completing it for them. But then, even if you look at it, it's almost nearing completion.
Exactly.
Yes, the doors have been fixed. And then it's left with the windows. It has been roofed, but yet we still also want to find out why that project has been left abandoned for the past 4 years. It's amazing.
Okay, yes. But let's talk about the condition of some of these residents, because they have lack or no access to healthcare delivery in the area. That's Kweikrom specifically, and you conducted that exercise for them together with other organizations. What did you find? What's the situation in terms of health amongst these residents?
You'd be surprised. We screened about 700 people on that day. And then out of the 700 number we screened, we had about 60% of them being screened of diabetics and hypertension.
60%?
Yes, both known and then unknown. Yes, and then we had about 22 out of about 340 women that we screened having huge sums of lumps in their breasts. And it's amazing for them. Most of them even say that they thought ideally the breast one should be harder than the other. Yeah, so they had no idea about whether that situation is alarming or not.
So prior to your going there, they had not had access to this kind of screenings and all that you happened to give them?
Never. In fact, because of they had to travel for about 2 hours before they can access the nearby
to go to
facility. So most often, even in times of ill health, they rely on herbal concoctions and herbal medications. Yes, they feel reluctant to do that. And also of the fact that the community is very poor. The residents are very poor. Most of them could not even afford the price or the cost of bathroom sandals. And so majority were even walking barefooted. So think about it, such a situation, financial difficulty, and for them traveling all the way to Winneba to access healthcare was a challenge. Yes.
Well, so from what you have seen, at least, it's not just the media talking about it. Your foundation has also seen it firsthand. What do you reckon should be done in the immediate for them?
Yes, as a matter of urgency, I think the CHPS compound project should be completed. I mean, if you look at the pictures, it doesn't take much to complete such a project. It is almost to completion. So we are still appealing on other stakeholders and other philanthropic organizations as well as the government to also see to the completion of this project. It could even be me and you.
Yeah.
If we were to find ourselves in Kweikrom, these are some of the challenges that we will be battling with our health.
And to think that pregnant women will have to go through more labor when they are in labor already to be able to access healthcare. But from what you discovered, you talked about the 60% lifestyle diseases, including diabetes and then, of course, hypertension. What kind of help were they given? Were they just screened and left to their fate?
Yeah, so we moved in with a team of specialists, and then some had even been referred to Winneba and other facilities as well. What we do as a foundation is that after the screening, if we even give referrals, we mediate that referrals to whichever hospital you are being referred to. So definitely those that we detected, for example, those with the lumps in their breast, everything is in control.
Okay.
Yes.
But how long has your foundation been doing this?
about a year now.
About a year now. Oh, okay. And so far it's been successful. How are you funding? You're doing this all by yourself?
Yes, that's our main challenge now. We are funding it ourselves, and sometimes it's very difficult. For example, so many things goes into it. This one we had to collaborate with Rotary Club of Dansoman to do that. And there are so many similar like villages like this who equally have these cases. And so we are appealing to other philanthropic organizations who can come to our aid and help us in that regard, yes, to extend our wings to other villages who are of the same situation like we.
Okay. Okay. Jeremiah Nkrumah, any relation to Dr. Kwame Nkrumah? Okay, no. All right, we'll leave it here for now. We're grateful for your time. I'm sure that my church maybe will partner very soon, and other philanthropic organizations and individuals watching will also help us with that. We're indeed grateful. Jeremiah Nkrumah is co-founder the Physical and Mental Health Foundation in Ghana, and they helped brought this situation of the Kweikrom to light.